Good evening, Chair Stella, Fashion and Dr. Catherine Connolly.
I welcomed the news yesterday of a new elective hospital. I hope it's the start and part of the overall new hospital that's needed, but in due course we might get clarification on that. I asked today my specific question, which is one of 5, trying to elucidate clarification or elucidation in relation to the situation in Galway. This is in relation to a cancer care centre, and I want to know precisely where that's at, if you could. And I asked that in the context of 51 people on trolleys yesterday in Galway, most of them in the accident and emergency, and in the context of this options appraisal, which I might get back to.
Thanks very much, Deputy, and thanks for your comments on the elective hospital. The National Cancer Centre is being looked at. In fact, I've had meetings on it over the last few weeks. I think it is an important project, and as you rightly say, it's one of several very significant investments now in healthcare in Galway. We had agreement yesterday on the elective hospital. There is a proposal in which I support for a 7-storey emergency and women and infants block, which is actually the size of a small hospital. It's a huge piece. I've been discussing with the hospital team the need to upgrade the labs. And then on top of that, so they also have a proposal in for additional bed blocks, for additional wards. And on top of that, then we have a proposal being developed. This very ambitious proposal for the a Galway cancer care centre. The proposal, Deputy, would be in excess of €100 million. I think it'd be very significantly in excess of €100 million. And so we will be going through the public spending code and the HSE capital projects manual and approvals protocol. The strategic assessment report, which is one of the important stages, is currently being reviewed internally within the HSE. It's intended that report will then be submitted to the National Capital and Property Steering Committee as soon as that can be done. If that's approved, then that's sent to my department and is sent to me for consideration. The government is committed to ensuring the continued improvement of cancer services in Galway, in the region, and in University Hospital Galway. As you'll be aware, Deputy, there's a really important new service coming online in the coming months, the radiation oncology service, state-of-the-art, several linear accelerators, €56 million. It's only one thing that's needed, but it will be an important additional service for patients in the region.
Minister, that was the options appraisal. I have a small library here and in my office in relation to Galway. Not fit for purpose. That's the comment of former Taoiseach and ministers. A letter on the 1st of November to all TDs and senators from the consultants and doctors telling us that the state of the hospital, and they tell us one hospital was built in 56, which is the main hospital, Merlin Park in 54. 95% of Merlin Park, 64% of UCG are not satisfactory, unacceptable, not fit for purpose. So within that background and years of asking for a brand new hospital, which this identified, a brand new hospital, not an elective hospital, a brand new hospital. Now there's confusion in relation to that. But specifically in relation to Cancer Care Centre, it serves, as you know, a region, 800,000 to 1 million people. And what I'm concerned about now is we're going backwards, because, you know, these gates, and I'm very familiar with them now, much to my, I don't want to be familiar with them, but I've had to, we're at gate 0. And now, on the last occasion, the report told us that the National Steering and Property Committee was reviewing the situation. Your reply today tells us it's been reviewed internally. So if you could clarify that inconsistency, please, or that difference.
What I can tell you, Deputy, is that the proposal is being progressed, and it is working its way through the various stages. The public spending code is a very laborious process. It was put in place after the National Children's Hospital cost overruns. There is a balance to be struck between managing the costs in the public interest and trying to build facilities as quickly as possible. My own view is that I would like to see these things move a lot quicker. I don't think we're good at putting in place healthcare infrastructure quickly enough. When it gets put in place, it tends to be very, very high quality capacity, but I share your frustration. It is moving forward, however, and I think it is worth noting that there is a lot of investment going on in the hospital. The radiation oncology building, as we said, there's a new 12-bed cardiothoracic ward, which is about a €5 million investment which I met the team there recently, is making a big difference in terms of patient waiting lists as well. So yes, projects at this scale take a very long time, unfortunately. I think they probably take too long, but it is only one of several very big healthcare investments that are coming into Galway and into the hospital.
Minister, we have 150 acres at Merlin Park. A site has been identified for a new hospital. Within that now we're progressing with an elective hospital. I welcome that. In relation to this, on the 24th of November, I was told, Ceist Hospital Group has made a capital submission to the National Capital and Property Steering Committee. So it went to the steering committee. Today's news tells us that it's not gone to the steering committee, that it's within the health executive for an internal review. Now, I appreciate you have a difficult job, and I've taken the trouble to put questions, as other TDs have, and to the Minister for Public Expenditure and Firm. We haven't even got to gate zero. And one question is undermining the other question. So it's extremely difficult. It's extremely difficult for you to be on top of this gate 1 to whatever it is, 5 or 6. But we are not making progress, because if we were, we wouldn't have a letter from the consultants appealing to us to do something, and all TDs acting together across party in relation to this. I have many other questions, but I'll stay within my time. Thanks.
Thanks, Deputy. I'm more than happy to look at whether or not there is a discrepancy in the answers that you've received. The update I have is that it will be shortly going to the property steering committee. So I'm more than happy to look at that. But I think importantly, what I would reiterate is I've met the clinicians. I've been in Galway a few times. I was there recently. We were talking about various capital investments. I've been meeting colleagues from around the House on this, and I want to fully acknowledge the strength of the case for a regional cancer centre. Galway is one of the 8 national cancer centres, and as quite rightly been pointed out, there is a deficit in terms of the capacity available for cancer care, and it is something that we are looking at, very aware of, and we will prioritise.